and welcome to Coffee with Cade. We're so excited that you chose to spend your lunch break with us talking about pelvic floor issues. So our speaker today, our expert today is Diane Dallap, and she's a physical therapist at MedStar National Rehabilitation Hospital who works with pelvic floor issues every day. So without further ado, Diane, would you please tell us a little bit about, first of all, what pelvic floor issues are, and then how you got interested in this?
Thank you. Thank you for having me. Well, I guess, first of all, I'm very lucky that I worked with someone that did this, I believe in like 2001, and was kind enough to kind of take me under their wing, because it is a population that's grossly underserved. I think it still takes quite a long time for people to come to a diagnosis, and there's a tremendous need there. So I was fortunate to have a mentor and kind of led me into this. So I've been doing this probably since about 2001, and I think it is more well known and talked about, and hopefully being diagnosed more often and better, I guess would be another term. So pelvic floor issues, it's kind of a broad net. You can have problems where you're leaking. You can have problems where you're having trouble having a bowel movement. You can have pain with sex. Sometimes people are uncomfortable even after they've had one child. And so, you know, what we do, and I think as rehab implies for any part of the body, is just try to create balance, appropriate level of tissue, tension in the tissue. And so, you know, if somebody comes in and has pelvic pain, we're often focused on trying to relax the muscles. And somebody comes in, I'm oversimplifying a bit here, if somebody comes in and they're leaking, oftentimes things are too weak, but it's not always quite that black and white. A larger amount where you're, you know, rushing to the restroom, you don't quite make it. And I mean, you might even have to, you know, full on change your pants. I've had folks that are, you know, they carry a whole cadre of things with them because they're just living with this problem, but it you know, we can help it.
Yeah, so sometimes people would know because what are they wearing pads or what because people may not feel like they're leaking, but sometimes they do things, there's behavior that you start to demonstrate to compensate for this. So what are some of the things that people do when they're really dealing with pelvic floor issues?
Okay, so if thinking more specifically about urinary incontinence and leaking, people will often, I call it bathroom mapping. Like, these are people that know, like, you walk into the mall and you know there's one at the Macy's, there's one halfway down at the food, you know, they know exactly where to go. They're going frequently to avoid, you know, having the leaks that you may have if you were to hold it longer. I have some folks that are going to the restroom every 15 minutes, and that's way too frequent.
What about during sex?
So it is possible to leak during sex. I don't know that that's something that I hear as commonly, but that's possible too.
No, but I mean, like, is using lubrication a sign perhaps that you may have an issue, or just painful sex?
Yeah, you know, as we get older, unfortunately, the tissue there, I often liken it to the tissue around your eye. You know, we're so gentle with the tissue around your eye. You know, it becomes a little bit fragile as your estrogen is dropping. And so things are drier, and it makes it uncomfortable to have sometimes even just a pelvic exam, or, you know, if you're still having your menstrual cycle, a tampon. And so, yeah, you know, needing lubrication, or, you know, and then sometimes it's not that simple. Sometimes there's also muscle tension, and it's hard because we can't see those muscles. But much like you get a knot in your neck, you know, that you can have a knot in your pelvic floor that if it's released, you might be way more comfortable.
Okay, so speaking of it's released, can you tell me a little bit about what pelvic floor therapy looks like?
So the first day, quite frankly, is a lot of talking, because often these are folks that have had problems, you know, what I would call chronically, meaning more than a few months, and it's often really years. And sometimes they even mention symptoms that they've had as kids. So, trying to get to any behavioral things that might contribute to their problem. So whether it's they're drinking coffee, which might, yeah, I know, which irritates the bladder, might make you pee more frequently or even leak. But there are also things that we eat and drink that may, as you pee, kind of irritate the skin in the vaginal area. And of course, same way, everything you eat and drink affects your bowel. So, we try to establish those things that we can change, and you'd be surprised. People are not always super willing. I know I love my coffee. But, it's worth making some sacrifices if you feel better. And from there, it almost looks like you're here for your spine. So we're looking for problems, kind of the whole picture. So looking for pelvic symmetry and flexibility, strength in the legs and the hips. And then we do perform a pelvic exam. I like to think it's a little more low key than when you go to the doctor, because I don't have the speculum. But it's the only way I can really tell what's occurring in the pelvic floor muscles, because again, you can't really access them, just like poking on your knee or something. So that gives me information about the tension in the muscles. Can they contract properly? How long can they hold? Do they relax properly?
So this is more like a manual pelvic exam, like
yes,
you get at your OBGYN office.
Yes.
Okay. Yep. And so, okay, that makes sense. Now let's talk about the connection between pelvic floor problems. And you've talked about different types of pelvic floor problems, but between that and infertility.
So I don't think pelvic floor dysfunction causes infertility, but I think it can obviously be a barrier. Basically, if it's painful to have sex, you're going to have a problem creating a baby. So you come back to some of those tension issues in the pelvis. Sometimes there's a painful episiotomy scar from a previous child, or again, maybe it's something that somebody's had their whole life. I've had some patients that have never even had a GYN exam because there's some anxiety and stress. So by loosening up those muscles, hopefully you make sex more comfortable, more enjoyable, and I think that will lend to improving your chances of getting pregnant.
Now, when you say loosening up the muscles, I'm envisioning yoga. How are we loosening up the muscles?
So as you mentioned earlier, I can do it manually. So I'm just using a single finger to press on the muscles, again, much like you would do kind of up in your neck if you had a knot there. Can't see the muscles, so it's hard to envision this, I realize. Okay. And we have dilators, which kind of look like very bland tampons, if you will. Okay. And they come in different sizes, so you can use those to kind of stretch the area. And you can even use them to do a little bit of internal release. That's a little bit harder. Excuse me, but they can be very valuable. And to be fair, a whole part of this is also just, some of it would look like yoga. I often recommend people go to yoga. If you...
I feel loose after yoga for sure.
Heck yeah, right? So if you loosen up the hip muscles, there's a lot of communication between the rotators and the, the glutes, your butt muscles, your inner thighs. There's a ton of communication between those areas and the pelvic floor. So if you have a tight muscle in your rear, chances are your pelvic floor muscle could be tight too.
Got it.
Excuse me. And so you often see these folks that often have what we call SI dysfunction, which basically means your pelvis is slightly shifted, or even low back pain. So those things are, is something you would see commonly.
So we just got a question. Is there something that you can take to lubricate those issues? And someone said that their health store recommended a variety of products.
I'm sorry, you said lubricate?
Yes.
Okay. So, it is possible that any lubrication would help. You do have to be a little bit careful. When I come in and when someone comes into me and they have, they might be a little bit more sensitive. I'm a big product of a big fan of hypoallergenic products. So there are some lubricants that are water-based, and that's what I try to use here. Some of them have propylene glycol. That's more drying. So again, for more sensitive skin, that might be a little tough. I have had, very rarely have I had somebody react to the water-based one that I use, but in those instances, vitamin E oil,
Vitamin E oil.
yeah, that surprised me a little bit, but that's what we used, and it didn't bother her. So we kind of went with that. But I guess take home point: try to find something that's water based and natural, and again, maybe just check the content list for propylene glycol. Maybe just make sure water's the first thing you see.
So, are lubricants part of the treatment, or is it more manually stimulating or stretching the muscles? Because everybody thinks of the vagina as something special and different, but there's a lot of muscles down there.
Sure, yeah.
Like everything else, right?
Yes. So I use the lubricant, during the treatment. And if your main complaint is that you're dry, that has got to be part of what you do in daily life. I guess you would call that a behavioral modification, so that things are more comfortable for you. But I don't think it does anything magic. So, if the tissue is a little sensitive, it's probably necessary, but the lubricant itself wouldn't be, relaxing the muscles. You got to do the other work, whether it's, maintaining healthy diet with things that aren't irritating, whether it's making sure you're stretching, using the dilator. So it by itself is not a standalone treatment.
Okay, all right. So you've talked about manually kind of stretching the muscles in the pelvic area and the vagina. You've talked about using some other tools to dilate, to make things stretch a little bit more. Are there other types of therapy that people, if people say, I want to go get treated for this, what other things should they anticipate?
Those are probably the primary things that I use, but there are biofeedback we use occasionally, which involves, again, kind of looks somewhat like a tampon that you would insert, and it has sensors around it that give you an idea what your muscles are doing. So we can set it so that, it makes a bunch of noise, and then we basically say, okay, you need to try and relax. And as you relax, you will hear less noise. So it's kind of teaching the muscles to, in our speak, we call it downtrain, meaning relax. So if your muscles are very tight, and again, I'm going to use the analogy with your neck muscles and your shoulders, somebody that's walking around with their shoulders up in their ears because they're tense, if you often just relax those muscles, you find that you're in less pain. So we do have biofeedback unit that can help make patients aware of that amount, because they may be walking around, they don't even know that they're clenching so much.
Now that's real. If you're upset, it's not just your shoulders that get tight. It can be your top as well, for lack of a more, I don't know, a nicer word, but you clench up everywhere.
Yeah, and perhaps it is situational, which is where I think the dilators come back into play. You kind of have to build some confidence that, okay, this thing can be in there. It's not going to hurt. And, obviously it's real helpful if your partner's patient and understanding too. But, for a period of time, I usually request that they don't have sex, because that might flare things back up until you can kind of work through the dilators and get an adequate amount of stretch.
Okay.
There's always homework. Yeah.
Okay, this is good. So, if people are looking for this type of support locally, I know you are at MedStar National Rehabilitation Hospital in Washington, D.C. How do you find a therapist do most physical therapists offer this type of support, or where do we go to get this type of therapy?
Well, and it's still one of the things that's perhaps a little vexing, is that I still think there's probably not a ton of us. There's a few of us within MedStar. I'm right in the middle of Baltimore City, and then we've got another lady out at White Marsh, and then we've got probably more down in Washington. So if you are interested in MedStar, you can search pelvic floor therapy. But in general, I guess if you were to try it, you could Google pelvic floor therapy and then carefully read the bios. I have had patients say that they were told it was pelvic floor therapy, and it sounded like it was more just like a lumbar treatment. The other thing that you could try is if you go to apta.org, which is the American Physical Therapy Association.org, and if you put in find a therapist or find a PT, I believe is the link. You can scroll down and put, I believe it's the choice is either women's health or pelvic floor therapy. And then you should be able to put in a zip code and locate somebody, hopefully within, not an outrageous distance from you.
Right. Okay, that's great. And what's the average amount of time that someone might need this type of therapy? I mean, is it like one and done, or do they come for 6 months, or?
It does vary. And, I don't know that there's specific research, but anecdotally, meaning my experience, I would say, sometimes the longer that you have this, it might take a little bit longer. So all the more reason when you first started noticing something off, please tell somebody. Speak up. But so, I have some people that might do pretty well in 4 to 6 weeks. Often I'll have patients come in twice a week. Sometimes once a week is fine. Again, it all depends on circumstances, insurance, patient schedule. And then I've had some that are with me for 3 to 6 months. Sorry to be a little vague with that, but it runs the gamut.
Okay. Well, that's good. So are there any other, we've got actually a little bit of time left. Thank you everyone who's been contributing questions. We've got the expert on the line right now. This is something that people talk about a lot, but are often scared, or they think about it a lot and they talk privately. We've got an expert who treats this very issue every day. Please share your questions so that we can get some information and support. You've already said that you thought that yoga, you recommend yoga for a lot of people. Are there other things that people can do on their own, if they're not in a position where they can access someone like yourself and get treated professionally? So,
I will often teach folks to do self-massage to the side of the hip, or, you have a partner that you're comfortable. So, not everybody's a great masseuse, but you can easily do it by yourself, lying on your side and just kind of working through, and you'll be surprised what you find. So if you imagine, if you're on your side, imagine your butt muscle, your glute, kind of like a big clock, and you go right in the middle of that glute. You often find a pretty tender area. So you could massage maybe 3 to 5 minutes on each side. And even the inner thighs, you could massage those yourself. You've got to watch with Pilates. I always want the core to be strong, and, we want stability through the pelvis and the core. But sometimes there's so much clenching of the abdominals and the pelvic floor involved with Pilates that, usually people take a break until we get things loosened up. That's not 100% of the time, but sometimes you do need to be a little bit careful with doing intense abdominal workouts.
Okay, and when we talk about yoga, is this any type of yoga, or hot yoga, or are there things we should avoid if this is a concern?
I'm not a yoga expert, so generally speaking, I would say, sure, try yoga. I love hot yoga personally, but it's not for everybody. But I do think there's great relaxation following hot yoga. So unfortunately, no specifics with the yoga, but you want to just watch putting stress in the area. So it sounds kind of silly, but the bike, if you ride bikes often, or even stationary bike, New Year's, everybody's out in the gym, the pressure that goes through the perineal, the crotch area, if you will, is often irritating. Even the elliptical, sometimes you've got to watch, like the seam of your pants can sometimes be irritating to the area. Horseback riding, not
pants, no tight pants.
You know, jeans in particular, because you know how thick that seam is on jeans.
Okay.
So I find that people come in yoga pants, that's okay, but probably the looser the better. Horseback riding is the other one that comes up, but that's not a common one.
Okay, so avoid anything that's putting pressure on your pelvic area. So we talked a lot about women and pelvic floor issues, but is this just a woman thing, or do men also have pelvic floor issues?
They definitely can. I treat only women at this point, but there's definitely pelvic floor therapy for men as well. Not only pain issues, sometimes after prostate issues or prostate surgeries, they'll have problems with either leaking or retaining urine, meaning you can't pee when you want to, and that's often due to muscle tension. So yeah, definitely same thing for men, tell somebody and they'll find you an avenue to help make it better. There's definitely affects both parties.
Well, what does it look like in men?
Well, I've had folks that have rectal pain, or as I mentioned a second ago, just that they feel like they have it almost mimics what an enlarged prostate would look like, even though they've had it treated. They have trouble initiating like a urine stream. They have sometimes pain with urination. Maybe feel like they're not emptying completely, or have to go frequently. Again, you get into some bad habits when you have the discomfort in the area, because then you just continue to go to the restroom way more frequent than you should. And maybe I should clarify, what we consider normal urinary frequency would be probably about 2 to 5 hours. Not everybody's on the 5-hour path, but hopefully you can sit through a movie is usually my bare minimum goal.
Okay.
So I think those are patterns that you start to see in both men and women.
So going at nighttime, is that kind of an indicator that this may be an issue? If you're going like, I don't know, once or twice a night, every night?
What I've been taught is that some of that is age related. Unfortunately, I think is once you hit like 60, 65, you're probably going to get up at least once, maybe twice. Anything more than that, and I feel like we need to fix something. If you're under 65, 0 to 1 time is usually my goal. I think a lot of that, so again, behavioral things. What are you drinking? Is it anything that's irritating to the bladder? Bladder irritants, caffeine, alcohol, anything acidic, smoking, a lot of healthy foods, but I think the biggest things are probably the caffeine, the sodas, and alcohol. So, not only avoiding those, but perhaps making sure you're not having those close to bedtime. But I think if throughout the day you're going to the restroom too frequently, you're kind of training the bladder wall and your brain that that's the amount that it can hold. So when in actuality, it can probably hold a much greater volume, but you've kind of now trained it that way. So it's giving you the signal that you need to run to the ladies' room. And I think some of that carries over into nighttime, so that you also can't hold as long as you should at night. You're generally not having much fluid intake while you're in bed, and should be producing less urine while you're in bed. So, you shouldn't have to get up as often. So, I'd say if you're above 65, 1 to 2 times, okay. More than that, let's try to fix it.
And is it actually fixable? Like at the end of a treatment, should you expect that you will have less pain with intercourse, or is this about kind of learning to navigate life with the symptoms?
Yeah. Well, I'm biased, but I think it is something that we can often improve. Maybe it's not 100%. Often folks do really well and they walk out with minimal to no problem. But I feel like most of the time we can make a nice improvement. It doesn't happen on the first treatment. Every once in a while it does. I guess I get lucky. But for the most part, it takes at least a few treatments. Probably not a perfect rule of thumb, but I think if you catch it sooner, you can reverse it sooner.
Okay, so catch it fast. It is an issue. It is treatable. And in addition to learning how to live with symptoms, you can actually get better. It
Yeah.
affects men and women.
Yes.
And some of the symptoms are leaky bladder, you're kind of peeing on yourself a little bit, having a hard time having bowel movements, right?
Yeah, that can fall into this category too. And you often see folks that have a combination of these things. So in other words, it's not just that they have pain with sex. Like the more you talk to them, you learn that, okay, well, there's this weird little glitch with the bladder and then also their bowel movements. So oftentimes the folks have trouble having bowel movements. They're not going often enough, or it's really painful when they go. Diet can, again, be a huge contributor, exercise. But tension in those pelvic floor muscles will make it so that things don't relax properly to push things out. So that can definitely be part of the whole cluster of symptoms as well, if not a standalone symptom or standalone diagnosis or problem.
Okay, all right. So are there any other things that people should be mindful of if they think they may have this? Any other kind of parting words that you have for people?
Well, I think the biggest thing, I've probably said it 4 times already, is just tell somebody. Don't let it go too long. Like I feel like I have a ton of folks that are like, oh, my sister has this and so does my mom. And I'm like, tell them to come in,
Right.
So just talk to somebody about it. You've got knowledgeable folks such as yourself that, if you mentioned it to someone, you might go down a path that makes your life a lot more enjoyable. And so I think some people just accept it, that they're going to have to pee all the time, or they don't leave the house as much, or they don't like to take car trips that are beyond an hour or something. But I guess I'm always cautiously optimistic that we can improve upon those things. I think just generally staying healthy. Oh, yeah, another huge thing is people stop drinking water when they have these problems. So water intake, not only for the health of the bladder, if you have really concentrated urine that's irritating to the bladder, and it's just generally not healthy. Every single cell in your body needs water. So
drink water.
Yeah, drink water. And again, it can have a positive effect on the bowels as well.
Yes. So, Diane, thank you so much for appearing on today's show. As you know, and as everyone else knows, this is Coffee with Cade, and we begin and end each program with the narrative, what's in your cup? Diane, what's in your cup?
Well, I do in fact have coffee in my cup.
Okay, well, good.
But I enjoy it.
Prepare for the program, and there is water in my cup. So, and for those of you who would like to follow up with Diane or get more information about a pelvic floor therapist, we will have a beautifully edited version of this available probably over the next day to 2 days on the Cade Foundation social media pages. Also, last reminder, our family building grant applications are due by February 1st. So if you are struggling with infertility and have a need for financial support for either adoption or fertility treatment, the Cade Foundation does offer grants of up to $10,000. And you can get information about that at our website, www.cadefoundation.org, on the grant page. Thank you. Have a great afternoon, and I'll see you on February the 5th for our next edition of Coffee with Cade. So until then, have a great afternoon. Take care. Be safe, everyone. Bye-bye.